First, I want to describe strip harvesting. Strip harvesting basically entails surgically removing a ribbon, narrow but long, from the scalp in the donor area, and then stitching that closed so that a linear scar is produced. The strip outside the body is dissected under special microscopes into the individual follicular units so that it is the naturally occurring follicular unit that is finally transplanted into the balding or thinning area. Now, unfortunately, scars from strip procedures have received a bad name, and either people have seen patients who now shave their heads and have very unsightly scars or multiple scars, or even advertisements which shed a negative light on the linear scars from strip procedure. It's unfortunate that that occurs because that is not our results from linear procedures, from the strip procedure. We utilize a closure technique which is very special. It was developed by Paul Rose, our surgeon, and works beautifully in his hands. It is termed the ledge trichophytic closure. What this does is that it creates a very fine scar with hair growing through it, so that sometimes not even the hairstylist, which combs up the hair, can detect where the scar is. Now, generally, the patient who undergoes a strip procedure will be committed to wearing their hair a certain length, let's say like a 2.5, sometimes a 2 on a barber's clipper, because you cannot guarantee that with very short hair that linear scar will not be seen. FUE is obtaining the follicular units in a completely different way. It is utilizing a little needle, which is a 1 millimeter or less, called a punch, to individually harvest, to perforate the scalp in a scattered array and remove individual follicular units, so that instead of a linear scar, multiple dots, tiny dots, are created in the donor area. These little dots are very difficult to see if the patient wears his hair extremely short, and that is the main advantage of FUE, that patients can really wear very short haircuts, almost military style haircuts, without having any detectability that a transplant has been done. Now, we utilize the ISHRS physician-controlled robotic system for FUE, which is the most technologically advanced system worldwide. The ISHRS uses digital technology and precision robotics to perform the FUE system extraction. The ISHRS system has continued to evolve, and now we actually have the software for the ISHRS system to actually make the little sites or tiny punctures in which to insert the follicles in the recipient's scalp. It is just a shame that while robotics continues to advance, attention to detail with beautifully performed surgical techniques and advanced technology has not kept up with the strip procedure, although in our hands we get excellent results with both techniques. Since the advent of the discovery in the early 80s that hair grows in small clusters of 1, 2, and 3 hairs, which are called follicular units. And when we started separating those individual natural units and using them for the transplantation, results revolutionized as far as how natural they became. We have taken the follicular unit technology one step further with a patented technology which we term Mosaic hair restoration. In our research, by taking magnified images of the donor scalp where baldness has not taken place in many different patients, we have found that the arrangement of the follicular units is unique for each individual patient, almost like a fingerprint or a signature. And what we do when a patient comes for a hair restoration surgery, we take images of the non-balding area of the scalp and then use the exact distances, proportions between the 1, 2, 3 hair follicular units to create an exact template where the recipient area is transplanted. Since we have started utilizing this technology, our results have become even more natural than they once were. Our clinic, both Dr. Paul Rose and I are board-certified dermatologists, which is the only specialty that has special residency training in hair loss conditions and diseases. Therefore, we not only utilize hair transplants to treat our patients, but a variety of medical treatments that are utilized to not only improve hair growth, but also halt the balding process. These treatments consist of either prescription medications, topical products, low-level laser therapy, and usually what we recommend are combinations of these treatments. We are now also utilizing what is called platelet-rich plasma, or PRP, and looking at its effects to halt the progression of hair loss and stimulate hair. Platelets contain what are called growth factors, and these chemicals or molecules are natural in the body and are involved in the process of hair growth. So it makes sense that drawing a patient's blood, concentrating their platelets, and then injecting them into the scalp and releasing these growth factors should be helpful in hair loss treatment. We have looked at many PRP systems and found in our research that the concentration of platelets varies greatly between the systems. We have now adopted a system that consistently concentrates the platelets so that we know we are delivering what is truly called PRP, or platelet-rich plasma. We have gone a step further, and whenever we treat a patient, we actually send a specimen of the blood that has been drawn and a specimen of the PRP to an independent laboratory. We actually provide the patient with numerical data and proof of what concentration of platelets they received in that particular treatment.